My name is Devalingam Mahalingam. I'm a professor of medicine at Northwestern University and a medical oncologist with a specialty in GI oncology at the Robert H. Lurie Comprehensive Cancer Center here in Chicago. We know that pancreatic cancer is a cancer that requires more therapies given its kind of dismal outcomes that we have seen to date. A patient usually presents with pancreatic cancer at advanced stage. And in most cases, the typical survival of patients with advanced pancreatic cancer is under 12 months. And in real life setting, even with the current therapeutic regimens that we have, which are essentially chemotherapy or cocktails of chemotherapy, the survival typically ranges from about 6 to 9 months on average. So we have done very little in the last decade to try and improve that beyond a year, and there's been a lot of work going on to try and do that. So we know that there's a pressing need to get more therapies for patients with pancreatic cancer. A lot of the work that I'm going to be talking about next is based on a drug known as Elraglusib, which basically targets a protein known as GSK3 beta. And GSK3 beta synthetase is actually a target that typically helps normal cells maintain balance in the body, basically when it comes down to glucose metabolism, insulin signaling, other signaling pathways known as Wnt beta-catenin signaling pathways, and it has a normal function in normal cells. But in tumors, when this function is disrupted, it co-opts GSK3 beta to allow for tumor growth, survival, and evading the immune system as well. Elraglusib actually started its journey here at Northwestern University about 15 years ago, and we found that when you inhibit GSK3 beta, you would actually lead to pro-apoptotic signaling that prevents cancer survival. And we also saw other interesting signals where we could see inhibition of the EMT, epigenetic modulation changes, reduction in fibrosis in tumors. But importantly, we saw that it actually changed the immune microenvironment to a more positive environment that will allow immune cells to come in and attack the cancer as well. So based on this finding, we decided to bring this drug to the clinic, and the first trials that were done were run here at Northwestern in conjunction with other academic institutions in the US, and we found that the drug was safe. We saw that some patients in early trials had responses, and then this led to the next study where we tried to combine with the standard chemotherapy for patients with pancreatic cancer, which is known as gemcitabine and nab-paclitaxel. So when we combined Elraglusib with gem-nab-paclitaxel, we were able to see that the clinical activity in patients with pancreatic cancer. Then that decided that we should then go and try and do a larger study where we were able to randomize the patients to either the Elraglusib in combination with the standard chemotherapy or the standard chemotherapy itself. And this study enrolled close to about 286 patients across 64 sites across the world, both here in North America and in Europe. And what we found in that study is that when we used Elraglusib in combination with chemotherapy, we showed an improved survival compared to just the chemotherapy alone, with the 1-year survival rate now hitting almost 44.2% versus 22% with the standard chemotherapy alone. So we realized that this drug was effective, and this led to a presentation that we just did in ASCO, that this is one of the first positive trials in pancreatic cancers, at least for all patients with advanced metastatic cancer in almost a decade. The study obviously needs larger confirmation trials, or what we call registration trials, before the drug becomes approved nationally. So I suspect that there will be more work done in this space in the coming years. But at least it's the first kind of unique target used for patients with pancreatic cancer, and there's already discussions about looking at this target in other tumor types that need this kind of both tumor modulation as well as immune modulation to try and enhance the effects on this cancer.